Hey, it's Heidi Dawson, and this is Wednesday Wisdom, where I interview wildly successful people from across the world, where we get an inside view into what their daily life looks like. Success leaves clues, and on Wednesdays, we're finding them. Join me now for the latest wildly successful interview. Hi, guys. Welcome to the Wildly Successful Lifestyle Podcast, and welcome to Wednesday Wisdom. Today is going to be so good. I am interviewing Carol Langsdon with the Langsdon Clinic. She's a nurse practitioner and has been making people beautiful and the best version of themselves since 1986. So she has so much experience with facial plastics, injections. She's spoken nationally on medical spas, clinics, and non-surgical and surgical facial aesthetic treatments. So, basically, Carol oversees all of the Botox, fillers, peels, and her husband does the surgical procedures. And I believe that when you are trying to be the best version of yourself, that you should do, within reason, whatever makes you feel beautiful. Now, I personally love Botox, and Carol and Phil Langston have become great friends of ours, as they started out as a design client of mine. And I've done the design for their clinic and their home. So without waiting one more minute, let me introduce Carol Langston. Hi, Carol.
Hi, Heidi. How are you today?
I'm good. How are you?
I'm great. The sun's shining. It's a beautiful day.
It is shining. It didn't start out that way. It was kind of cloudy this morning when I went for my run, which is good because I did have my sunscreen on, though. You'll be glad to know.
Yes, I'm glad to hear that.
So I'm so excited about this because you guys have such a great practice, and you're not too far from my house, which actually makes it quite convenient. And you've run a successful facial business for really over 30 years. And your husband is Dr. Langston, and he's been voted one of the top facial plastic surgeons in America. And he's just so cool and calm. You both together are, and I love that. Now, you guys have won a lot of awards over the years. How did you get started? And what do you think is the key to your success? Because you've had a lot of it.
Well, I think, we started back in the 80s. I hate to admit it, but it was difficult starting a facial plastic practice at that time because the internet did not exist as we know it today. And it was hard for patients to find someone that has such a niche doing just facial plastics. So we were just very determined and started out. He was like working in the emergency rooms, seeing people with lacerations, car wrecks, so on and so forth.
Right.
And I was there in the office with him. I was the first employee. And, there were some tough days, but we persevered, and Retin-A came out in the late 80s, and then in the 90s, at the end of the 90s, Botox came out, and then it was FDA approved in 2002, and aesthetic treatments became more mainstream, and people were able to find physicians and providers, by searching on the internet, and that has helped.
Yeah, it's so true. Internet, I think, has probably been such a boost to every single business because it is so easy to find everything just like right at your fingertips. you can
Right.
search, and you can also search like all information about whoever you're looking up. It's really been a great tool, and I know that helps you guys too. So now I personally love Botox. I remember when the very first time you basically were like, you need Botox. I was like, okay, all right. Thank you. And now I'm so addicted, like I cannot stop it. But can you explain, because so many people don't really understand, and I didn't either until you told me how it works and like how long it lasts and all that good stuff?
Well, Botox is a neurotoxin, meaning it stops the nerve cells from communicating with the muscle, and it is a medication. And when it's injected properly, it will target certain muscles to stop moving or paralyze that muscle. It was cosmetically approved in 2002 for the wrinkles between the eyebrows. And before that approval in 2002, we had been doing a research study with Botox in the late 90s. So we knew about it before it came out approved cosmetically, and many offices were beginning to use it. But a lot of practitioners didn't know the proper dosage and exactly where it should go. So we were in the beginning of all of the Botox, before it first became approved.
So when it became approved, you hit the ground running probably.
Right, right. Because we'd already had several years of experience with it before it was FDA approved.
Okay.
It was actually kind of an ophthalmologist, a group of ophthalmology physicians were using it for blepharospasm, people that have like eye twitching,
Okay.
and they, as they were treating that it was helping crow's feet, it was getting rid of the wrinkles. So it was just kind of
Ah,
something that just happened.
so that's how it came about. It was
Yes,
accident.
yes, and then they
Oh
started
my goodness.
studying it for cosmetic use, and then it just exploded.
So then Botox got its start accidentally, which is so incredible to me. And is it something that people could use kind of preventive? Is that, I don't know, that is that a thing where you could use it preventively? So you start before you even get wrinkles, or is that a bad idea?
Well, I mean, you could, and there are a lot of providers that may do that, but we feel strongly that, it's a neurotoxin. Unless you are starting to develop wrinkles, you really shouldn't start, Botox treatments until you're developing wrinkles. Some people are advocate of people very young getting it before they have wrinkles. I'm the mother of 3 adult women. And I would not inject one of my daughters that did not have a wrinkle with Botox.
Okay.
You don't know that you're going to develop wrinkles there. You're just assuming you will, and I just feel that it's an unnecessary treatment when someone is not developing wrinkles.
Okay. Okay. Well, that makes a lot of sense. I mean, because you're right. You'd have no clue if you have it and then you've injected something and
Right,
you need it.
but you never needed it.
Yeah. Okay. So you numb the area. Do you always numb the area, or is it just for big babies like me?
No, we use a lidocaine, prilocaine, phenylephrine cream that's topically applied, and you
Okay.
can feel the injections, but it kind of takes the edge off of it. It also helps shrink the tiny little blood vessels and can help with bruising if someone is prone to bruising. I know a lot of providers do not always provide that. It is, something additional that we take the time to do for our patients.
Right. I can't imagine getting it without it. I
And,
don't
I,
think.
and I've had patients come to me that have been to other places out of state or wherever where they did not provide that, and they're kind of like shocked, like, why didn't my provider do this? And this is so much better. And I just feel that the less pain, the more apt someone is going to come back to have another treatment. Because if something is very painful, it just kind of, you just don't want to go do that again.
I know that's very true, but for me, like I'm so used to like the way it looks now that I think I probably would. I
Well,
might I might have to have a glass of white wine before or something, not
well,
red.
well, next time we'll try your injection without the lidocaine.
No, no, no. No, let's not experiment with that. There's no reason to
Okay.
do that. Okay, so mine lasts, I find, I kind of burn through the Botox. Now some of my friends it lasts for 4 months or 5 months.
Right.
I'm like at that 3 month point, I'm like, please let me come in. So is there a factor to that of why sometimes it lasts longer than others?
Well, it's very individual in that someone that's thin, that exercises a lot like you do, tend to metabolize it quicker, and it may not last as long.
Okay.
So people that are sedentary and tend not to be as active, or they may not be super thin. It may last longer for them.
Okay. All
But
right.
that's not always true. I mean, there's some people that are very active that it does last. It typically will last 3 to 4 months.
Yeah.
Some people it will last 6 months.
I know. When I first got it, I think it lasted a little bit longer, maybe, or maybe it was just in my imagination. But I now I kind of like, okay, at the 3-month point, I'm ready to get it. And which is probably about right, I would think.
Right,
So,
right.
okay, cool. All right. Well, so now your office, your clinic offers several things. Is there anything that is sort of a hidden gem at your office that you don't, that maybe doesn't get as much, um, I don't know, play as Botox does that we should be doing?
Well, I guess if you're talking about non-surgical, we offer different levels of chemical peels, and we also have, laser treatments. Um, a lot of people aren't aware of tricorcetic acid-based chemical peels because of when the lasers came out, everybody ran to the lasers. The tricorcetic acid chemical peels can be very effective, and they're not as costly as a fractionated laser treatment. Of course,
Okay.
the type of fractionated laser treatments we do here are done under IV sedation. It's a deep ablative treatment. It's not a treatment you would compare it to a medical spa. It's more medical. It's done in the operating room. The triprocetic acid chemical peel is something done in the clinic where you don't have any sedation, and it's less expensive.
I've
So
done that, right?
you
Is that
have,
what the,
yeah,
okay. And that was, it's so quick. I mean, you did feel pain, but it was so quickly gone. As soon as you put the water on it, it's gone. So,
right,
but it's
right,
very effective. I,
yes.
I love the way my skin looks after just even like, I think it's 3 to 5 days for me. And but it takes me longer I'm so sensitive to things. So,
Well, there is downtime, and it takes, 3 to 5 days. And with chemical peels, and a lot of people don't understand this, and we try to educate them. If you have absolutely zero downtime with a skin treatment, the result will be minimal. The more downtime, the more of a result you will see. So you have to kind of be able to tolerate that downtime if you're wanting to see a significant difference. So say someone in their 40s comes in and they get a glycolic chemical peel, they're not going to see really much of a result from that. And there's no downtime to that. That's not saying those pills are not a good treatment for the skin, but you shouldn't expect it to
it's not going to be
get
like, oh my gosh, people are going to
right.
see you on the street.
And then the other thing about our clinic that a lot of people don't know is that, and this is more the surgical side, we're a fully licensed outpatient surgery center, licensed by the state of Tennessee and Medicare certified beyond to certify our operating room. And it's a very, safe environment for patients. So we do all of our surgeries here.
Okay. Yeah. I know that because I've been there and I've been back in there and seen it all, with walking through for design. So it's so cool that you have that right there instead of having them to go somewhere else because it's so much more comfortable. I can imagine they already feel good because they've kind of done their consult there and then they have it done there and then their family just picks them up, which is it's
Right.
super nice. I'm glad you mentioned that because that makes
Yeah.
a big difference.
Well, it's very private, and especially with COVID right now, it's a safe environment. It's a private environment.
Yes, yes. Okay, that's great. Great to know. Now, I will say that there is one thing that I think is kind of a little hidden gem, and that is your exfoliator product that you guys have come up with. Even if I didn't do anything else, like if I run out of that exfoliator, I have to come get it. I might can use like a substitute eye cream if I run out. I'll be like, okay, well, I'll use this for a few days until I can get that. But that exfoliator is so good. How does that work? Like, how does that
Well,
exfoliator work so well?
it's a glycolic lactic, excuse me, lactic acid cream, and it just helps get the dead skin cells off the top layer of your skin. Because as you age, you just build up dead skin on the top layer. And it's very effective when used with retin-A. People use that at night and then use the exfoliation cream in the morning. And then you add in like a vitamin C cream, which is an antioxidant, which is really good for your skin. So we kind of went through, it was like in 2008, we developed that exfoliation cream and then did the complement products to go with it, and it's been very successful. A lot of our patients use it.
I love it. And it's different from exfoliators I've used before, which has kind of a grit and then you wash it off. This is a cream that you put on and then you can kind of feel it, but I notice that my skin glows when I'm using that.
Yes. No, it's a very effective product.
Okay, so good. I like that. And so if anybody, we'll talk about how people can get in touch with you, because I would I want to be the spokesperson for that product.
Okay.
Okay, now sometimes I see people and it's so obvious that they've had work done, or they've had like too many fillers, or you guys, I don't see that coming out of your office. I mean, and everyone leaves looking so natural, and the people that I know that have been there for even big procedures, they look so natural. So, I mean, they just look like a younger version of themselves. It's not like a different person walking out. How do you keep it where people look so natural?
Well, I mean, it's just key not to over inject, and then the surgery. You know, my husband is very good with his facelift surgeries, and it's just the techniques that he uses.
Okay.
Um, and then I have many patients that come in and they may want something that is not going to be a benefit, and I kind of, if someone's over injecting their cheeks, I will tell them, your cheeks are
Oh,
getting too big, it's looking unnatural. And the same thing with lips. um,
yeah.
we see a lot of overdone lips, and that's just because that individual has gone out and has gotten too many fillers, and have gone to providers that are not saying your lips are looking unnatural.
Yeah, it's sometimes I think as a person that, I'm a typical woman. Like sometimes we can be kind of critical of ourselves, but also we kind of get you can have sort of I don't know, a unreal expectation of yourself, and then you look in the mirror and you're like, oh, my lips are so small, but they're really not. So I guess you guys don't, you sort of take that aspect away. You're like, no, we're going to be honest with you. We want you to look natural. We want you to look good. And you don't let people do that, which is great.
Right, right. I mean, you as a provider, you have to be able to say no. And
Yeah.
we
Well, and
do.
because it'd be easy for you to just say, "Oh yeah, just give me your money, and sure, we'll
Right.
connect you." But that's why I think part of the reason why you're so successful is because people keep coming back. You know.
Well, I always say, if you need more, we can put more in. you know, there's no reason to over inject a filler.
Right.
That
Right.
treatment
We can
day,
add it.
yeah, let's look at it in 2 weeks, come back. And then we have a lot of patients that come in from out of state, and we work with them, and I have to try to figure out a time when they can come back, or we can talk to them, over Zoom, which has been really good. um,
Right.
because
Well,
sometimes they may need to come back and get more, and it can be a little bit inconvenient, but it's better than having a result that's not quite what you're looking for.
yeah, so you could look at them over Zoom, or you and Dr. Langston could look at them over Zoom and say, yeah, no, it looks great. Give it a
Right.
minute. You still have some swelling or whatever, or you could say, yeah, let's do a little bit more. You can use it. So Zoom has been wonderful for everybody's industry, I think. So, all right. So now you have been making women and men also, let's not forget the men, because you do a lot of men as well, look so much younger for a very long time. Like out of the non-surgical services that you guys do, which one would you say gives you the most bang for the buck? Because it can be kind of expensive.
Right. I guess I would have to say probably, it's a tie really between Botox and a mid-level chemical peel. Um, and when you say, bang for the buck, meaning does it cost less, or you're seeing more of a result even though you spent more, you know,
Yeah,
both.
I think is it what would it be that would, looking at someone's face, that would make them appear, you know, have a different appearance, like less wrinkles with Botox, or smoother skin with a chemical peel. Basically, just which one, I guess you'd have to decide for yourself, huh?
Well, I mean, and of course, skin resurfacing, you have to use a good medical grade skincare program before you get a chemical peel to get the best results. So it's going to take longer to achieve what you're looking for. With Botox, it takes basically 7 to 14 days for it to take effect. So you can see your result from your Botox, within 2 weeks.
I did when I first did my Botox. The next day I was sitting with my little sister, and she was like, she hadn't seen me in a week, I guess, and she goes, "Why do you look 5 years younger? I mean, what is?" She didn't. I hadn't told her that I had done it, and I went, "Do I really?" And she said, "Yes. What's going on?" And then I told her that I'd gotten Botox the day before. So maybe the very first time it sort of is, you know,
Well, that is true. I mean, some people, it can take effect, quicker. That
yeah.
is true.
Okay, cool. Well, that's all good information. Now, what can someone do to make their skin look younger if they're not really ready to have any of the services like Botox or chemical peels? What is there like a skincare regimen that you have seen that works that you suggest?
Well, of course, I suggest our Face MD skincare line, and using Retin-A with exfoliation cream and vitamin C is can help, and it's a big difference in someone's skin when they start medical grade skincare, say in their mid 40s or even in their mid 30s. The difference that it makes in the next decade of their life. I'll have someone come in at 60 that's never used medical grade skincare versus someone that comes in at 60 that has for over a decade. There's a huge difference in their skin. And then, of course, sun is very damaging. If you don't use sunscreen, you're out in the sun all the time, you're going to see the difference in your skin when you get into your 50s, 60s. It's very damaging.
I can attest to that, as you know. Now you talk about vitamin C, and since you told me this, I don't, my skin doesn't tolerate your vitamin C serum very well, but I started taking vitamin C like a lot more than what I had been because you were like, "Oh no, we take this." So I love the fact that vitamin C makes your skin shine as well. I always feel, but you have a serum that's really good. Like I have friends that love it, like I do the exfoliant. So it looks. I wish I could use that but it kind of irritates my skin a little bit. But I love the retinol and the exfoliation too. So
Yeah.
all of that works really well. Okay, so then this has all been really good, but I have one more question. So you have been so successful for so long. Is there any bit of advice that you would give to yourself back when you were just getting started?
I probably would have purchased stock in Botox. So,
Okay, so everyone out there listening, think about what's the next big thing.
right.
Probably someone that would come up with a vaccine for COVID. I don't know. Maybe.
Right. So,
Okay, but we're not giving stock. I'm not telling anybody to go buy stock.
no, I don't know how much their stock is now, but obviously, if anyone had known, we'd have rushed
Wow,
out and
yeah.
purchased that. But I guess
That's
I don't know that we would have done a lot of things differently. It
okay.
is, we're very blessed. We enjoy what we do, and we're still doing it daily, and we get a lot of joy from our patients. I enjoy my patients. I have been seeing many of them for now 14, 15 years. um,
Yeah.
I know about their
It
kids.
feels, you know what? It feels that way because whenever I come in there, it feels like I'm walking into like family. I love coming into your office. Not only is it beautiful,
Yes, it is very beautiful, and
I'm
we
not
enjoy
patting myself on the back,
it. No, it's beautiful.
but it
We
feels good. Like everybody in there is so friendly and happy. It just seems like a fun office. Like I bet it's a fun place to work, but it feels like a good place to come in and hang out too. So.
Yes, yes.
Okay, good. Well, how does someone get in touch with you if they want to talk to you about any of your services? Is there a best way?
Well, just call our office. And of course, our website has a lot of information, and that's drlangsdon.com, but it's spelled langsdon.com. There's has everything that you would want to know really about the practice and
Yeah.
about
It's
what
a
we
beautiful
provide.
website too, drlangston.com. And
Yeah.
does your site have an Instagram?
Well, it does. We do have an Instagram. we don't post a lot. We're trying to get better at that. And
Okay.
I think it's Langsdon Clinic.
Okay. All right, good.
Um, and then our skincare products, you can actually buy them online. We just set that up through Shopify, and it's facemd.net.
Shopify, facemd.net.
Yeah.
That is awesome. All right, that's great news because for people, I have friends that use it and they're like, I've got to run by the clinic and get this, So, and I do the same thing, but I like coming in there. So,
Well,
all right,
we
Carol.
ship it everywhere. So
Okay, and it is fabulous. So I encourage everyone to get on there and take a look at that. It's really, really good, especially that exfoliator and the vitamin C too. That is,
yes, the vitamin C is a must, Heidi. We've got to find one that works with your
I know
skin.
we do have to find one because maybe I need to just try this again, because sometimes maybe it was something else. But in fact, I may do that
Right.
because I do take vitamin C. You were telling me about the vitamin C, and so I started taking it. But anyway,
Okay,
well, this has
good.
been so much fun, and I know you have tons of patients that are waiting on you to make them beautiful. So I'm going to let you go. But this was so much fun, and I thank you
Oh,
for.
you're welcome. We'll talk again soon.
Okay, bye, Carol.
Bye.
Don't forget to subscribe and share with your friends because we're just going to keep going bigger and better places together, and I love that about us. Talk to you in a few days.